Hi, thank you. I'm Dr. Rahul Singh, pediatric neurologist. I work at Guy's and St. Thomas's Hospital, been involved with inherited white matter disease, that is IWMD, leukodystrophy, for a long time now. So I've been showing you this presentation about registry for God knows how many years, and it has taken a lot of work, but the good news is it is finally live. So this is the IWMD National Service team, Cheryl, Lydia, Deepak, Evangeline, Amitav, and David is our adult inherited white matter disease specialist who is based in London. So registry is live, and it went live in January, February time. There were some technical issues, and now we have 347 patients on the registry. The registry is a web-based cloud application which is hosted by NHS England, RN and GEM, and this service is led by Guy's and St. Thomas's Hospital. I lead the service, and we have Mr. Mahfuzur Rahman, who is the National Data Manager. So every IWMD service, there are 3 pediatric inherited white matter disease services. One is based in Leeds, Manchester, one in Birmingham, and one is London. Every center, they have their own data manager. And I don't know, out of 357 patients, I have not seen any input from the families. As Lydia was saying, that your genetic condition is very unique to you. Even 2 kids in the same family with similar genetic condition might not behave in the same way. Someone will have more symptoms, someone will have less symptoms. How do we understand them as a clinician looking after them, as a group looking after these kids? How do I start? What is their timeline? How did the problem start? Which was the most problematic problem? So I think this is a great initiative by NHS England. This is totally funded by NHS England. The sole purpose of this registry is to support our clinical management, what best we can do for our patients. So this is the web page. If you go on this web page, So this is the web page. This is the home page. There's an option to sign in. Welcome to patient registry for IWM. I want to take time and take you through step by step, because I've tried to do that in my previous talk, and something didn't work. So this is, you have this background and about the inherited white matter disease registry. This is the second page. You can register yourself as an NHS staff. So it doesn't matter, you don't need to be an IWMD clinician to register in this. You can be a GP, you can be a pediatrician, you can be adult neurologist, any person can register as a service provider. You can register as a patient. If you yourself are a patient and you feel you should be able to input the data, you can fill in the initial request, or you have patient representative. A lot of our kids, they need representative, and also for adults at certain stage, if they can't input their information, they should be able to register themselves. So when you go to the patient section, they will tell you how to get involved, what is going to happen to your data, what resource and support you have. There is a standard operating procedure for a lot of things, and then the frequently asked question section is there, which addresses all your questions, and we will need your feedback as well, as what do you think, and if you want us to modify anything. So I have signed in as a lead for the inherited white matter disease registry. So I have access to all the patients. I can manage all the user, and this is my profile. If you are from Leeds, you would be able to look after your patients in this group. If you are a GP registering 2 patients, you should be able to look only at those 2 patients. So this has gone through a lot of governance and confidentiality, this thing, and people have been given role-based access. So, so I am registered as a service lead. So once you register, there is an email which goes to a data manager, and he approves. He will check your identity, and the approval will be given to you. That will be done through an email. And once you log in, so every patient is assigned IWMD number, and you can search them. Clinicians can search them with their date of birth or whatever center they are involved in. So there are 6 sections in a registry. One is the patient summary, which is the patient demographic, which place they belong to, then key medical information, then current treatment, follow-up medical information, and all these 4 sections needs to be filled in by your medical professional. You have option of self-reported information for an individual with an IWMD or a patient representative reported information. So, in the key medical information, we have which IWMD center they belong to, details of referrer, what is the diagnosis detail, and all these clinical data, genetic data, MRI data will be included. So, if you go to IWMD center, the different centers comes from the drop down menu. Who is the person entering this data? Who had referred these patients to the registry, and the specialty of clinician making diagnosis, maybe a genetics person or a metabolic person has made the diagnosis. And we want to know out of our patient population, we see there are a lot of patients where we suspect this is inherited white matter disease. We might not have got an answer, and there is a confirmed diagnosis. So we want to see right from at what age the diagnosis was made, and how much time it took us from to get to the diagnosis, because all these things are going to reshape, reconfigure our service and what we do for our patients. So it is easy. I would say it is not difficult. It's a bit time consuming for the first time if you are inputting an information, but then follow up and everything else becomes easier. So if there is any clinical data we want to put in, like from vision, hearing, other thing, this is an option to put in there. And then the family history, is the patient the index case, is there someone else in the family affected, and was diagnosis confirmed. These are all important bit of information which we might not realize immediately, but in long term it will be. What does the MRI show? Any other scanning was done for the patients, and any other investigation. The more information we have, we would be better in coming years to understand our unique genetic condition affecting our child or our patient. Here you see there is an option of what sort of treatment they are receiving, where are they getting the treatment, are they on any advanced therapy, are they included in any clinical trial, and what is the impact of those treatment on the care of the baby. This can be timeline. If you are on all 5, you will have option, it populates here 1, 2, 3, 4, 5. And in follow-up section, you can update it and see whether the treatment is working or not. This is the follow-up medical info, where you see any new investigation done, any change in diagnosis. And this is a disability scoring system. Because this is an all-age registry, we were not sure to how do we put one outcome patient. So we have done this. This is more relevant for adults, but there are a lot of information which we can extract from these data later on. So we will talk about the service later on, but all the services are there is an MDT support. It's not just me. Metabolic person, geneticist, neuroradiology, genetic scientist, neuropsychologist, they are all part of the team. So all the cases what we discuss, there is an MDT discussion, and there is an option to upload them. And understanding death, what was the cause of death, as Lydia mentions, that is not the white matter progression which leads to death. If you can prevent them from developing secondary complications, you can give them a good quality of life. That is also our aim, and if there is an advanced care plan with the child, we can record that, and access to support group, Alex TLC, they have been doing amazing work. And at some stage, if patient loses their ability to input the information, or of one parents have 2 or 3 kids, how do they register under the same name? So we can, there's an option to assign representative at later stages. So this was for more for clinical information, radiological, what sort of common minimal data we want from all the centers, how do we move forward. That will shape our future in 5 years time, 10 years time, we will understand these conditions better. And the most important bit is your information. I couldn't get it from the registry because no one has filled in, and trial one has gone. So what it says very clearly when you go on the registry, this is not an alternative to your if you need urgent medical attention, you should not use registry as a source. That is more for a safety thing. But here, what you can report, how are you feeling? What happened in the last 6 months? Was there something you wanted to access and you were not able to get it? It will alert your IWMD center. It will definitely alert the lead center. If we see a pattern from a particular region, we might activate few things. We might talk to a few people and say that, guys, we need to change something, or commissioning new. We need to think it in a different way. So how is it impacting your mental health? And there is a similar sort of scoring system here as well, which we used in the initial section, clinical section. So you will be reporting on all those 5 domains: your mobility, your personal interaction, your participation in community, what is happening, and there are 2 more domains. They are all numbered, and then we can compare your score with the clinician's report. That outcome can be very helpful for all of us. And one thing what we didn't want to do, based on our initial, it's just a teething problem, I think, that we don't want you to get overwhelmed by the amount of information we put it on the registry, clinical information. So you won't be able to access the clinical data, but if you want to know what information clinicians have on the registry, there is an SOP for that. There is an email you contact, and you can get, like you can get any medical record. This registry is supposed to help all clinicians to give you a better clinical care. So we don't need consent for your information to be put it on the registry, because first port, when I register a patient, an email will go to the family. And we tell them, if I see them in clinic, I can't see, it's not possible to see everyone, but we feed back to the referring consultant that the information will be inputted in the registry. We can't use this registry immediately. If we want to do a research or trial, then there is another, we need to get permission from our steering committee, and that will be approved properly. Then only we can share it, and the steering committee meets 4 times a year. So that is all good. So far, let me give you some result. Peds London, 159 patients have been registered. Birmingham, 81. Leeds Manchester, 47. We have 44 patients from adult IWMD center. And then these are all work in progress. It's very good. So I'm not just a registry person. I have a full-time clinical responsibility as well. So these are the list of my patients, which we have seen it in London. These are all new ones. So, the registry information, what we are inputting information in the registry is for the patients we have seen since the service has started, but we have a big pool of patients who were diagnosed before that, and we need to think about them, how do we input that. So, you see the last bar, this is possible inherited white matter disease. This is quite a significant proportion. Out of 159, around, I would say 50% to 50 of them, we don't have a diagnosis. We strongly suspect they have inherited white matter disease, and we are working on it. So, we see them whenever we get new information, this thing. So, that is work in progress. This is Leeds pediatric diagnosis. So, and this is from Birmingham. So, different conditions, we do see that kids we find a gene, but we don't see any gene related problem now. So, what do? So, when we keep an eye on them till they are 16, 17, and then transition them to the adult clinic, so that they can be kept, someone can keep an eye on them. So, this is adult registry data. We are getting some new diagnosis, some we don't know what to do with the diagnosis, some we just need to keep an eye, and yes, if there is a treatable condition, we don't want to miss that. So, these are the patients so far. So, in our I have data for London Pediatrics, everything like we have 200 new patients since the service started. There were 335 encounter in the MDT for these patients, because one patient might have been discussed 4 or 5 times, 159 on registry, and this is possible inherited white matter disease, 50 patients. It worries me, it is taking time, and registry will help me understand how much time it has taken and how do we minimize that. And then there were patients who were very unlikely to be inherited white matter disease, but there was some change on the MRI scan and they wanted to keep an eye, and 19 of them where we saw them, it was not inherited white matter disease. So, molecular diagnosis confirmed in 71 to 76, work is in progress. I am talking about total population, and referral to genetic counseling was offered in it is around 55 patients, and then 15 got genetic counseling done, and diagnosis confirmed in other family members, 25 other family members affected, 42. So, this is not from, okay, so this is good, live, work in progress, plenty of information to gather, and it has a huge potential. But we are having initial problem, like if parents are trying to register, they go to a QA site, that was the testing platform site. So, adding pediatric patient as a patient is a bit difficult, because for pediatric patient you need a representative. So, the email goes to the carer and then carer authorizes it. So, sometimes we use the incorrect email address of the patient, and clinicians using their own email address instead of putting carer email address. These were the live issues which has happened since the service was started. And if initial design was to add a second dependent this thing, we are having some issues with that. Lot of clinical information is missing. We need more, and I feel that the more information we have, it will be better for our future, and so it takes time. Every clinician, everyone is busy. We are getting support from data manager, CNS, and Alex TLC. In fact, they offered they can provide someone to fill in the information and get the information. So there's some confidentiality issue. We are sorting that out, and I have not seen. Despite of some of the parents I have approached directly, I don't see any information coming from them. So, there is going to be a workshop, JD is going to do that. I want to interact with more parents to see how best I can support you or we can support you. So, future is good. It has lot of research potential, and we will understand our landscape better. If if I'm asked by someone that what is the incidence of this particular white matter disease in the UK, I'm blank at the moment, but in 5 years time that won't be the case. If I want to understand how much time, how did their journey was with that particular genetic condition, I would be able to say that. And data managers really helpful. I'm grateful to Mahfuzur, Jade, and Kat, everyone who has inputted information. We can get some more support, and we are working on analysis of report, how to talk, like if you put the date of onset of symptoms and date of deterioration, then you can see what sort of timeline they had deteriorated. And one important question was neuropsychology assessment, because we don't see that cognitive involvement in pediatric population that much. It can happen at a later stages for adult as well, so that has all been included. And of course, we will get a natural history data for a lot of them. We just need to modify the outcomes. So we will expand the registry participation. We need more clinical coordination. Of course, without you all, we won't be able to do and get more research initiative when we have more data. Thank you.
Thank you so much, Dr. Singh. It's, you know, the registry is going to be so important, as Dr. Singh said, for natural history, for finding new research. It's, you know, and we're really lucky actually to have the registry, and it's supported by the NHS. So that's quite unique, isn't it, I think?
Yeah, I see this as a work in progress, where we were 5 years ago and what we will be in 5 years time, that landscape. I'm looking forward for it. Okay.
Thank you. Is there any, oh yes, question? Have we got a microphone?
Oh, I've got a load of them. How does one get a patient initiated to be registered on this registry?
So just go on the website, register as a patient. We get alerted that someone wants to get an access to registry.
I just Googled trying to find the registry and I couldn't find it. We need to talk later.
Okay, I will show you. Oh, and yeah.
Hi, thank you. Is it going to be rolled out across all the 4 nations, Scotland, Wales, Northern Ireland?
Yeah, absolutely. We involve all the devolved nation, Scotland. We have already been getting patients from there as well. So Scotland, they normally feed into Leeds, Manchester, IWMD service. For Wales, they feed into Birmingham IWMD service, and basically patient can be registered to any service if they wish to. So they will be included in the registry, and there was a talk from NHS England to include overseas patient as well with a particular, we are not at the moment, things are very much in the initial stages. We are trying, there's some teething problems there, but devolved nations are involved.
One second.
If people are on the registry, they'll have a better chance of getting involved in medical trials?
So if I have data for someone and someone wants to know, do you know patients for vanishing white matter disease? I would say, you know, I've got 3 on registry. Then can you approach your clinician? They are based at these centers. We should be able to give you that information. Of course, it will help. And even having the initial preliminary data and the genetic detail, that would reduce the time. So, yeah.
Thank you. Some great questions. So it's going to be Slido time again.
Okay. I won't look at this.